I mean, I think that, again, it's the same thing that we talked about in the last episode of technology being better.
Hi, guys. Welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. I'm board certified plastic surgeon, Dr. Smita Ramanathan in New Jersey, and I'm here with my co-host, Dr. Ashley Amalfi, up in Rochester, New York. And we are here for our second part of answering all of your questions about breast surgery. So we're so excited. This is a really fun episode for us because that's what we're here for. We're here to answer your questions.
This is
Ashley, hi.
Hi, this is like so conversational, you guys. These are the questions we get. We sit in the office with you guys and we just get like hit with like 100+ questions like this a day. So it's kind of fun just thinking off the cuff. And literally, Smita and I are just reading these off our phone to each other. So we kind of have no idea what's next. So let's just
Yeah,
do it.
let's dive
Yeah.
in. Yeah, go
Want me
for
to
it.
ask you one?
Yeah, let's do it.
Okay. This is like a unilateral question about mesh. So she says, if I have mesh on one side, will this cause there to be long-term size or measurement issues if I only have it on one side? That's interesting.
That's
Um,
interesting. Because
yeah,
I don't know. I mean, have you used the mesh unilaterally typically?
I usually don't. And so that's
Yeah,
so
neither do.
if they did, my thoughts would be they probably put mesh on one side because one side was not staying supported. And so it was bottoming out, meaning the implant was kind of sliding too low and they used the mesh to like stop it. If I'm going to do that, I usually do it on both because
Me,
I get worried about exactly what she's asking us about, that like long term, is that going to be perfect because as gravity and stuff pulls the other one down, then this one might stay exactly where you put it because that Velcro effect of the mesh, and then the other one might settle out with age. So it could be an issue. Is that what you're thinking?
I agree. I mean, I think with the breasts, listen, I do this even with incisions sometimes. Like if somebody on one side has more, needs a bigger lift and they need like the anchor incision versus the other side, like I want things to match as much as
Yeah.
possible because inevitably all of the scars, all of the cuts, all of the repositioning that we do, adding mesh, all of these things contribute to how your breast ages in the long term. And
Yeah.
so we try to make things as equal as possible and knowing that our breasts are sisters, not twins. So there's always going to be minor
Yeah. Amen.
asymmetries, but I think, yeah, right. But I think, when you have that extra support on one side that you don't have on the other, it may look great in the near term if, you're actually correcting, like you said, a bottoming out or a
Yes.
malposition, but
Fixing
over
it.
time, it's just going to age differently, I think,
Yeah.
right?
So yeah, I would always ask your doc about, does it make sense to do it on the other side? And I would say as plastic surgeons, we probably always want to say symmetry, but there is risk in operating on a breast that's perfect
Yeah.
because it's still surgery. So you could get an infection on that side. You could have a healing problem on that side. You could have a new problem when you
Mm.
don't. So I think there's risk either way, and it's worth having a discussion. It might depend a little on your skin, on your tissue, on your age, a lot of variables there, but that's a cool question.
Yeah. I like that. It's very interesting.
They're super
Um,
specific. I love you
yeah.
guys.
Okay. When you get a mastectomy, can you get an internal bra at the same time?
Oh, you bet.
Yes, you can.
But yes, you can. And I would say the way that people do this is probably all a little bit different, but I really like to do like a little auto augmentation when I do a lift. So kind of moving their own tissue up to give them a little more upper fullness. And then I put the internal bra on that and close the skin over the top. So I think that works really well. If I'm doing huge lifts and reductions, I don't know that the internal bra is as useful, but
Yeah.
on the smaller auto augmentation kind of lift technique, I like it. How about you?
Yeah. No, I think so too. And I think a lot of it also depends on, your skin quality, right? Like if you've lost a lot of weight or, you just your skin is just not robust and strong, then, especially on those moderate lifts, the smaller lifts, it makes a huge difference.
Yep,
But again,
it's cool.
the bigger you are, it's, if we're adding implants, which, obviously we can certainly add the mesh to that too, but everyone's a little bit different. And so that's why, again, it's so important to like talk to your surgeon, make sure you're going to a board certified surgeon, and make sure that you have these conversations with them. But yes, it's definitely a possibility. It's a great option if you're the right candidate for it.
Just ask. I mean, a lot of people will if I don't bring up using mesh, a lot of people will be like, should we use mesh? Like you guys are so educated and savvy that you're kind of like already asking the right question. So if you've like thought about it and we kind of give you a plan and you're curious, just ask because we can talk about it and decide like if it makes sense for you with what we're seeing and if it's sort of worth the investment. But super cool.
Yeah.
All right,
Yeah.
should we
Love
do one more?
do one more. And this is a little bit different because this is about mastectomies. So, what about women that are facing breast mastectomy, implants under or over the muscle? So, mastectomy is removal of the breast tissue for cancer or
Yep.
prophylactic to prevent cancer in the future. And so, under over the muscle.
I mean, I think that again, it's the same thing that we talked about in the last
Yeah.
episode of technology being better. I think technology is better. We have better things, we're talking about mesh, we have different types of dermal suspension, we have really advanced implants. And I think all of that allows us to be less invasive and use your body less and use technology more so that you have a quicker recovery and less injury to your own tissue. And so for me, that means using all this technology so we can go on top of your muscle and give you a beautiful, long lasting result, less pain, quicker recovery, and using the latest and greatest. So
Yeah.
not something I'm doing in my practice anymore. I don't do breast recon anymore, but I think all the technology and all the techniques are pretty similar in their evolution. What do you think?
Yeah, same. I used to do breast reconstruction a lot when I was up in Boston. I don't anymore in my practice. But again, the technology is so great now. And the less invasive we are, right? The less we disturb your own tissues, your own planes, just the quicker and better recovery you'll have. And again, it's all about the technology and adapting to the new technology that we have. But surely everybody has their own techniques. Sometimes it varies based on your personal story. And what's best for your anatomy and your skin quality. And there's a plethora of things that might, that will be involved in the decision making. But over the muscle is typically what we try to do with the current technology.
I agree. I think that's it's the most current, it's the most up to date. It's probably the most advanced way to do it. And again, we're not doing these anymore. So, but
You go see
um
your breast reconstructive plastic surgeon.
yeah, we're not, we're certainly not the experts in this space anymore, but I think, it's still breast surgery and I think the trends are the same. And I would say, ask a lot of questions about sparing your muscle because I think long term you're going to have great results still and a lot less pain, a lot less discomfort, and a lot less complications down the road related to that muscle movement. So ask a lot of questions about this, you guys.
All right, guys. Well, we have so many questions that we were going to make this a two-part series on
We're going
breast
to do
surgery.
three, right?
We're going to, great. Yeah. So we will be back next week answering more questions about breast surgery. And we love these types of episodes, guys. So please comment, ask questions, like us,
Yes, ask questions.
subscribe
This is
questions.
cool. This should be a tradition. I mean, I hope you like it. We like it.
We like it. We have fun. Um,
It's fun.
you can find us on YouTube, Spotify, and Apple. And we will see you next week. Don't forget to
All right.
subscribe.
See you guys.
Bye.